The future of healthcare is changing. It is moving towards a more proactive, preventive, personalized, and participatory model. Good morning, everyone. Thank you for joining me on this very hot, very beautiful day. So, today's talk is a little bit about my story and a lot about where healthcare is going. When I started med school, I was taught the gold standards of diagnosis. Things like mammograms, like cholesterol panels, like colonoscopies. They could decide where we need to intervene to save lives early. But they didn't teach us how to optimize health, how to prevent disease from happening, and how to listen to the deepest story behind a person's health. When I started my career, I started working in cancer care. And day after day, I saw the devastating toll that disease has not just on the body, but on the mind and on the spirit as well. But what stayed with me wasn't the suffering of the patient. It was the questions they asked. Things like, "Doctor, why did this happen to me?" Or, "Could I have done something different to prevent this?" I was their doctor with more than 10 years of study, and I was unable to answer their question. So I started thinking, could we actually intervene early enough to prevent disease from happening? And is there something where we can empower people to take control of their own health? And this is where my journey started in integrative and preventive medicine. Today, I come with a vision to transform healthcare as we know it, from a reactive model of care to a more proactive, preventive, and personalized model, where it is not about treating illness anymore. It is more about allowing people to live longer, happier, more fulfilled, purposeful lives. The old model of care is based on main things, which is evidence-based medicine, randomized controlled trials, cost effectiveness. That means third-party payers and number needed to treat, which is more of policy making really, and on reactive model to disease. But it lacks this proactivity in preventing things. If you think about it, COVID-19 revealed to us that skinny doesn't mean healthy, and that your health markers on paper do not reflect how resilient you are to disease. Here, especially in the MENA region and in the Middle East, we are prone to cardiovascular disease and to metabolic disease. Did you know that 1 in 6 people are affected by diabetes in the UAE and 50% of them are left undiagnosed? The future of healthcare is changing. It is moving towards a more proactive, preventive, personalized, and participatory model. Proactive means we do not wait for things to happen. We take things into our own hands. We use continuous monitoring like glucose monitoring, AI-guided metrics. Think of a retinal scan that could examine your vessels and show risk of vascular disease before it even happens. Preventive means we tackle root causes of things. Things like microbiome health, gut health, hormonal imbalances, stress markers to prevent early burnout. Think of personalized disease. No two people are the same. I do not react to food the way you react to food, and I do not react to drugs the way you react to drugs. This is why with genetic testing, epigenetic testing, microbiome analysis, and much more, we're able to tailor personalized plans for the lifestyle, the need, the commitment, and even the budget of people. And finally, participatory models. This model where you sit in a cabinet for 10 minutes, where your doctor gives a one-stop shop, one-size-fits-all pill, and you just receive, it's yesterday. We are confronted with people who are much more aware. They have great questions. They want to be sharp, they want to be energized, they want to be focused, and they want to be agent on their own biology. Today, technology is helping this happen. Things like continuous glucose monitoring, smartwatch, the Whoop, the Oura Ring, we're able to track the metrics of people and to realize when to intervene and how to optimize their health. And today, as lead consultant in CosmeSurge, I am piloting a new innovative way for health assessment. We are no longer doing quick assessment. We are looking at the deep stuff. The biology, the genetics, the epigenetics, the microbiome, the emotional health, the behavioral, the nutrition, the sleep, the recovery, the exercise, much, much more, and even childhood adverse events. All this analysis, along with hormonal subtlety, along with many metrics that we track in real time, would give us a wellness score that we're able to track across time. This holds us accountable, and this helps us to give and refine better results for our patients. So really, we are no longer looking at reacting to disease, rather at helping individuals take claim of their own full potential. Now, this is made possible, of course, with the advancement in AI. If you could picture a bit the future, it is no longer a snapshot of your health where we don't know what's going to happen. It's more like waking up that morning feeling so refreshed, not because you slept well, but because your smart bed actually put that alarm in that perfect moment in your sleep cycle. And then your virtual assistant welcomes you. Good morning, Cherine. I hope you slept well today. Your metrics are great. You hydrated well yesterday. You recovered well. But I want you to lower your cortisol level. This is why at lunch, I advise you to head to the Wellness Hub in your company, where you will receive sound healing and light therapy to lower your cortisol level. At night, your smart toilet will analyze your microbiome. It is connected to a big server of data. It will actually change your personalized supplementation plan. No, people, this is not science fiction. This is the future, and we are at the heart of it. The UAE is placed to be the leader in this. With its innovation, commitment to excellence, we are here at the heart of things. Us, doctors, policymakers, innovators, we will lead this transformation from reactive care, where we're actually trying to catch disease, to a more fulfilling, purposeful, happy, long, wellness lives for people. Thank you. Any questions? I'm happy to answer anything you'd like to know.